Okay, sir. Now I'm going to be moving on from the cardiac portion of the exam to the abdominal assessment, okay?
Okay.
Okay, I'm going to be starting off with inspecting. I'm going to inspect your face, your hands, your skin, your general overall appearance, looking for any rashes, pallor, lesions. I don't see any of that. And then I'm going to move on to inspecting your abdomen, specifically looking for pulsations of any arteries, which I don't see, any waves of the bowels, such as peristalsis, looking for asymmetry, distension, also inspecting your umbilicus, seeing if you can visualize any hernias, which I don't see for you. Then I'm going to move on to auscultation. First, I'm going to auscultate the 4 quadrants with the diaphragm, the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. There I'm listening for your bowel sounds, any hypo or hyperactive bowel sounds. Everything sounds pretty normal. You should hear anywhere from 5 to 30 bowel sounds per minute. And then now I'm going to auscultate your vascular sounds, first with the diaphragm and then with the bell, listening to the aorta, and then it splits off to the iliac and the renal arteries. And also the femoral artery, which normally I would auscultate underneath the clothing. And then I would do the same thing with the belt, listening for any bruit, which would be any turbulent blood flow. Okay, I don't hear any bruits. Now I'm going to move on to percussing the abdomen. First, I'm going to percuss the 4 quadrants. I should hear tympany, which is the normal sound with percussion over the abdomen. If I hear any dullness, that could mean there's ascites present, or any hyperresonance could mean that there's air trapping inside the bowel. Now I'm going to move on to percussing your liver. The borders of your liver should start around your umbilicus, move my way up until it changes from tympany to dullness. You can mark off that spot there, and then start higher up in your intercostal spaces and percuss my way down until I feel the change again from dullness, from tympany to dullness. And then I would measure, and the normal size would be from 4 to 7 centimeters for your liver. And then I could also percuss your spleen borders, which could be harder to do because normally the spleen is completely under the rib cage. But I would find your 12th rib, and I would move up to the 10th intercostal space, and I would be over the anterior axillary line, and I would percuss an intercostal space. And then I would have you take a deep breath and hold it. And if that sound changes to tympany, you can let go of your breath, thank you. Then that means that the spleen is under the rib cage, and it's a normal sign, normal finding. Then I would move on to palpation. I'm going to first lightly palpate your abdomen in the 4 quadrants. That's just to get you used to my hands and to get you to relax your abdominal muscles. And then I would move on to moderate palpation. Okay, and then for deep palpation, that's when you can actually find different abdominal structures such as the liver, the spleen, and see if there's any pain associated with any problems you might have. So I'm going to deeply palpate so I can find the liver. So I'm just going to push up under your ribs and see if I can feel the border of the liver. Okay, and same with the spleen. Spleen you should not actually be able to palpate. If you can palpate it, that probably means that it's enlarged. There's something more going on there, such as mononucleosis. Now I'm going to move on to Murphy's sign. That is a test that could indicate cholecystitis. For that test, you would do the deep palpation of the liver, have you take a deep breath, and if there is, if you elicit very severe pain on inspiration, that could be a positive sign for cholecystitis. Then for McBurney's sign, you would deeply palpate 2/3 of the way between the umbilicus and the ACES. You would find that spot there, and you would deeply palpate. And if you elicit pain there, that could be indicative of appendicitis. And then I'm going to move on to the obturator test, which is another test for either appendicitis or peritonitis. So I'm going to have you bring your knee up. Okay, good. I'm going to internally rotate your knee and externally rotate your knee and see if that elicits any pain there. And if it does, that could mean possible appendicitis or peritonitis, like I said. Also, I could test rebound tenderness. You could do it both on the right side of the abdomen, the lower quadrants. Push down and quickly release. And if there's any pain, increasing pain actually as you release your hands, that could be a sign for appendicitis as well. And the last thing that I need to do today is to palpate the abdominal aortic, or for a possible abdominal aortic aneurysm. That would be just above the umbilicus, right around that area. You would feel for the pulsation. Try to feel both sides of the aorta. If it's greater than about 1.5 to 1.7 centimeters, that could mean that there's possibly aneurysm, and further testing would be indicated. So that's it for the abdominal assessment, and thank you very much, sir.
Welcome.